many of you know someone who's overweight? Maybe you think of an aunt, uncle, parent, maybe even yourself. Today, 1 to 3 members in your family are considered obese. To lower this percentage, I am proposing that the state of Oklahoma should make healthier food choices more accessible and more budget friendly. Today, I'm going to talk about how obesity has become a problem in the state of Oklahoma, what has caused this, and a solution to this problem. Oklahoma currently ranks third in obesity rates in the United States. Oklahoma trails right behind Louisiana and West Virginia in obesity rates. Oklahoma has a prevalence of 35%, while Louisiana and West Virginia has a prevalence of 40.1 and 41%. According to a KSU article published by Julian Taylor in September 2023, it states, Karen Hacker, director of the CDC National Center of Chronic Disease Prevention and Health Promotion, said in a news release there is not a one-size-fits-all approach to combating obesity prevalence. Now that you know how much obesity is a problem in the state of Oklahoma, I'm going to tell you how it has become a problem in the state of Oklahoma. Oklahoma schools do not teach students properly about food choices. In the 1980s, it brought the idea of fast food that was available for every meal. It used to be an occasional meal, but today it's become every meal for every day. Many of us were probably told that some foods were good or some foods were bad, but not really told why. A pharmacist from Oklahoma named Dr. Kathy M. Campbell wrote a book based on her popular TED Talk titled Obesity, the Modern Famine. And in her book, she states, our fundamental ancestral knowledge of food began to disappear. Children no longer learned about food by working in the garden or on the family farm, or as they watched grandma work her magic in the kitchen, or even in a high school economic class. Instead, they learned about food from cereal advertisements during Saturday morning cartoons. By not learning anything about food, besides from advertisements, and by not cooking anything in the kitchen, students have no knowledge about what they are eating or what they are supposed to be eating. Children in Oklahoma are also more likely to grab a soda than a fruit or a vegetable. A 2023 Cocoa News article titled New Report Shows Oklahoma Children Are More Likely to Grab Soda Than Fruit or Vegetable that was reported by Colby Terrell states the data put out by the state puts us far below the healthier national averages. It also states, according to the report, more than 72% of children in Oklahoma, ages 1 to 5, had at least one sugary drink in the last week, which is more than 15% higher than the national average. In the same article, the Oklahoma State Department of Health Wellness Coordinator named Laura Larson stated Oklahoma actually ranks 13th in the nation in terms of highest childhood obesity rates, and that means 1/3 of our children in Oklahoma are considered obese or overweight. She also states, this is largely due to environmental factors including lack of access to nutritious and affordable foods. To restate the article, children in Oklahoma are more likely to go grab a soda than a fruit or vegetable and will continue to reach for that soda. Even when students are properly educated, they can have trouble deciding what to eat due to the budget. This is why I propose the state of Oklahoma should make healthier food more accessible and more budget friendly to lower these obesity rates. One reason that people can change their weight is by changing their diet. But pricing can be difficult when changing your diet. In a Hawthorne University presentation titled Diabetes, Obesity, Metabolic Syndrome, and the Microbiome with Dr. Liz Lipinski, the presenter is Dr. Liz Lipinski. She is a licensed nutritionist. In this presentation, she talks about changing your diet. An example of a diet that she recommends is a high probiotic rich food diet. An example of one of these foods is yogurt. According to Walmart.com, a 4-count of 5.3 ounce Keogh's Triple Zero 15-gram protein, sugar-free, fat-free, mixed berry Greek yogurt cups are $4.38, while an 8-ounce bag of Lay's classic potato chips are $3. By looking at the ounce sizes and the nutritional value, you would pick the yogurt. But if you're going based off price because you're on a tight budget, you would probably pick the chips. Price can have a big effect on people's food choice when it comes down to deciding what to buy. Obesity has become a major problem in Oklahoma and around the world. While children are not being properly taught about food choices, there are many other factors that contribute to a high obesity rate. Many healthy foods are not accessible or affordable. The state of Oklahoma should make healthier food more accessible and budget friendly to lower obesity rates. By doing this, we can start to lower the obesity rate in Oklahoma and around the world, but also continue to live a healthy lifestyle. Thank you.